good morning. Can you tell me what's going on today? Okay, so not feeling well. And what are your issues? Okay. And how long has that been going on? And what are your other symptoms? Okay, so sore throat, fever, headache, muscle aches, and you said very tired. Okay. And then any nausea? I'm so sorry to hear that. And how long have all these symptoms been going on? Okay, so quite a while. Well, I'm glad you came in. And let me just ask you a few other questions. Are you taking any daily medications that are prescribed? Okay. And then what have you been taking to help with your symptoms? And has that helped? Any medical issues I should be aware of? Do you smoke? Do you drink? How's your appetite been? Okay, yeah, that's common. Have you at least been having some soup? Bread? Okay. Have you interacted with anybody recently that's also been sick? No. And then what about any vision trouble? Okay. Well, I'll probably just check your vision anyways, just to make sure. And then any other symptoms I should know about? Okay. Then I will start the exam and hopefully get you feeling better very soon. So I'll first just listen to your heart and lungs, if that's okay. Okay, so just sit back and you can just relax. Actually, most of the tests that I'll be doing are pretty relaxing, so you don't have to do much. Okay. So just breathe normal for me. And I'm just going to listen to your heart. Very good. Very good. Very good. Now I'd like to listen to your lungs. So just a few deep breaths for me. Good. Good. One more. Good. I'm just going to place this on your back. Good. Good. Okay. Everything definitely sounds normal, which is good. Let's just check your blood pressure. Stick your hand right through here. Relax it. And do you have a history of high blood pressure? Okay, good. And And what was your temperature the last time you took it? Okay, and when was that? Okay. Just gonna take it again. Stick this right into your tongue. Just hold still for a moment. Okay. Alright, so it's still 102. Doesn't look like it's gone down too much. Alright, so I'm gonna put my gloves on and then feel your lymph nodes. And you said they feel pretty swollen. Just gonna start feeling. And is this a little bit sore? Yeah, it's definitely swollen right here. And then can you just turn your neck a little bit? Good. Just want to see on the back of your neck here. I do see a few raised bumps. Here, here, and here. Kind of like a pink, reddish color. Let me actually look with the light. Have you experienced any itching on the back of your neck? Okay, so you weren't even aware that you had this rash. Have you ever had a rash before? And does it hurt when I touch right here? What about right here? Okay. Let me actually take a moment then to look at the rest of your body. So, can you roll your sleeves up? Just gonna look at your left arm. Just feel it. Okay. And let me just take a look. Can you flip over your hand? Okay. Let me see your right arm. Just feel it. Look at the light. Can you flip it over? Good. Okay, now I'm going to ask you to just turn for me. And I'm just going to lift up your shirt if that's okay. I want to see your back. Okay, so let's see here. Don't see any rashes on your back. No weird bumps. Okay. So it's just on your neck. Alright. Can you turn back around for me? I'm just going to ask you to open your mouth. Okay, good. Stick out your tongue for me. Okay, any throat pain? Can you say for me? Okay, good. Everything looks good in your throat. Let me just take a look at your ears real quick. Any ear pain at all? Okay, what about any discharge? Okay, good. So then no signs of infection. Just take a quick look then. Your left ear first. Okay. Looks fine. And no pain right here when I touch. Okay. Let's do this one. Again, looks fine. Any pain? Okay. don't see any redness. I don't see any discharge. No signs of infection. So nothing that I'm concerned about. I do want you to do a few things for me. Can you lift your arms up? Good. And do they feel numb, swollen at all? Okay. Any tingling? Okay. Now can you lift your legs? Good. Just gonna feel. Do you have any numbness? Tingling? Okay. This one too. Lift again. Good. Okay, you can put your leg back down. Okay, can you push on my hands for me? Okay, very good. So now I'd like to feel your abdomen for a moment. So you're just going to feel a little bit of light pressure when I push down, okay? And then a few little taps as well. Just going to be checking for swelling in your internal organs. And let me know if anything hurts, okay? Okay, just lean back. I'm just going to do some pressing. Any pain? Good. I'm going to do a few taps. Any pain? Okay, good. Alright, so I didn't feel any swelling internally, which is very good. So the last thing I want to test is your eyes. Just look directly at me for a moment. First, just going to test your pupils. So keep looking straight ahead, my nose. Just testing your pupil reaction. Okay, good. Good. Okay. Now, just look around for me. Just in all different spots. Just keep blinking and moving your eyes. Okay, good. Okay. And then look. See this dot right here? Can you just stay focused right there for a moment? And I'm just gonna look a little bit closer. Okay. Perfect. Now look around again. Very good. And let's see. Same thing. Look right here for me. And I'm just going to look a little bit closer. Okay. Looks good. And I'm just going to hold your eye open a little bit for a moment. Good. Now this one. Good. So I'm just going to dim the light for a moment and then take a look once more. So just look straight ahead again. And I'm just going to check your pupils again. And can you look to the left? Now look to the right. Now look down for me. Good. And now look up for me. So we're almost done. Just one more eye test. Alright, so I'm going to cover one of your eyes. And can you just tell me when you see the light? Okay? So here we go. Good. 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 So based on my exam, I'd like to order a blood test for you. Is that okay? Alright, because I actually might think it might be mono, but I just want to get confirmation of that. Your symptoms do align perfectly. And have you ever had mono? Okay. So I'm going to order a blood test. And I actually wanted to give you, I do have some itch cream that I would like you to take home with you. And you can just put that on the back of your neck. It'll really help with the sores. And then a few more things. So once you take the blood test, I'll be able to confirm within an hour or so if you have mono. If you do have it, the biggest thing you need to do is rest. So I'm going to make a note for you. No exercise until you feel better. Now I know you've already been sick for a whole week, but it might take a little bit longer. So I will write you an excuse from work. No aspirin or Tylenol, just ibuprofen. Every 6 to 8 hours as needed. No alcohol, but please make sure you increase your daily water intake. Wash your hands regularly, and do not share any food or drink for the next few weeks until you're better. And no kissing as well, because it is very contagious. Now, if it comes back negative and you don't have mono, then I would suspect this is just a really bad cold, so I will follow up and call you with some tips if that's the case. And if it is mono, there is no specific prescription I can give you, as antibiotics do not work against viral infections such as mono, so you will unfortunately have to just follow the steps I just outlined. Okay? Alright, well, I'm so sorry you're not feeling well, but we're going to get to the bottom of this, and my colleague at the front desk can schedule your blood test in a few moments. Okay? Alright, perfect. Well, thanks so much for choosing me as your doctor today.